Good afternoon, everybody. Wonderful to see so many of you this afternoon. Thank you for joining us. For those of you who don't know, I am Donna Meltzer. I'm the CEO of the National Association of Councils on Developmental Disabilities, NACDD. And we are so thrilled today to be able to host this wonderful conversation that we are about to have with some dear friends as part of our Get Out the Vaccine campaign. It's been very important to NACDD that we provide really good scientifically based information for people who are looking to learn more about the COVID-19 vaccine. And we're here to help folks figure out if the vaccine is right for them and ways in which they can access this vaccine. We certainly know that many people have questions about the vaccine and some have had hesitancy, whether on their own behalf or for a family member, but we feel strongly that getting the right information can help lead to the right decision making. With that, today we are going to have a conversation with some people who are really critical in supporting people who live with IDD in the community, and those are direct support professionals, or DSPs. Today we're going to hear from some really amazing people who are out there every day working with individuals with IDD who they themselves had to ask themselves deep questions about this vaccine. Is it right for me? Why should I get this vaccine? What do I need to know in order to make a really important decision for myself, for the clients that I serve, and for my own family and community? So we are joined today by partners of ours, dear friends, with the National Alliance for Direct Support Professionals, NADSP. I would first like to introduce NADSP's President and CEO, Joe Mcbeth. Joe is with us today, and I'm so glad that you're here with us today, Joe. For those of you who don't know Joe, he has been in this business of supporting direct support professionals and really taking this lead in helping to bring value and respect and really building advocacy and a movement that recognizes the work of DSPs. Those of you who are people who live with IDD or support others with IDD, or maybe are family members of people with IDD, you understand this, but not everybody in our world understands this role and value, and particularly what it's felt like this past year as we have all coped with this pandemic. So we're thrilled that Joe is with us today. We're happy to have you here. And Joe, we value your leadership and your work. And folks, you can read his entire bio on his own website for NADSP. That's nadsp.org. But I do want folks to know that Joe has been in this field for a very long time and actually did start his own career as a DSP. So he comes to this with a lot of passion and personal experience, and it shows in everything that he does. So with that, Joe, I'm going to turn this over to you to share a little bit about NADSP and your work, and then to introduce your team of folks today who are here with us to share some of their personal reflections.
Thank you, Donna, and thank you everybody at NACDD. It's an honor to be here with you. This is obviously a topic that is critically important to us as an organization because a lot of attention has been put on the healthcare workforce and being vaccinated. The NADSP has spent the last 12 months providing a lot of tools and resources for the direct support professional community. Information about the vaccines, information on how to take care of yourself during a pandemic. Direct support professionals have been in the spotlight for the last 12 months, oftentimes putting themselves and their families at risk. Early on, as Matthew will probably tell you, in New York City, there was just so much uncertainty and so much fear about what was happening and what's going to happen. Direct support professionals not even able to get to work using public transportation. So over the past 12 months, we've learned a lot, and we've shared a lot of information and like I said, a whole toolkit for direct support professionals. And ultimately, how can we help people with intellectual and developmental disabilities stay safe from this virus, at the same time live their lives. And we have the good fortune during this past year, we through a very rigorous process, we vetted dozens and dozens of direct support professionals to join the NADSP's Direct Support Professional Advisory Council. In order to be on our advisory council, you have to be a direct support professional working full-time, not a frontline supervisor, not a trainer, not somebody who used to be a direct support professional. We need to hear directly from direct support professionals. So we spent several months looking through applications, and from the hard work from my colleague, Nicole Dama, who's taken this on as her own leadership challenge, to mentor a group of 12 direct support professionals from all across the United States, and 2 from Canada. One of them is with us today. And we need to hear from them. We want to hear directly from direct support professionals. And through the course of the year, we've also worked with our colleagues at the University of Minnesota, the Institute on Community Integration. And just last week, we released a 6-month follow-up of a direct support professionals in COVID-19 survey. More than 9,000 direct support professionals completed these 2 surveys, each one, 9,000 in the first one that we did about 8 months ago, and 9,000 more that we just released last week in the 6-month follow-up. This is very compelling data. And I think that NACDD posted a link to that survey report in the chat room. Please use it, share it. If a state had more than 200 direct support professionals respond to this survey, that state received their own state-specific report. We want you to use these reports, the data in these reports, to affect public policy. If you've heard me speak before, you know I can go on and on about direct support wages, the lack of career ladders, the lack of professional recognition. This data will help us get there. So the NADSP, I'm so pleased to introduce my colleagues in direct support, Matt Crawley. Matt is a direct support professional for AHRC in New York City. He works in a day services program in Brooklyn, New York, more specifically Flatbush, New York, Flatbush, Brooklyn. And he's been doing this at AHRC New York City since 2007. Like many direct support professionals over the course of the past year, Matt has been working as a direct support professional remotely, providing remote services in a day services setting from his home. And I've got some questions about that, and we'll get to that as well. I'm also very pleased to introduce Pat Ejenavi. Pat is our friend from Toronto, Canada. She emigrated to Canada from Nigeria in 2006. She earned her developmental services worker diploma from Humber College. And she works in Toronto, Canada for Vita Community Living Services, which is an organization where our friend and colleague Dave Hingsberger also works. And last but not least, Kelley Shepard. Kelley is a direct support professional who works for Mainstay Life Services in Pittsburgh, Pennsylvania. She's been doing this job for a long time, and in her bio on our website, it's great. She tells us that she started working in fast food and realized, you know what, there's more that she can do. So she picked up a job as a direct support professional. And a lot of us come into this field temporarily. You know, we'll do this job for a little while. And here I am 38 years later, and I suspect Kelley's going to be here for a while too. So Matthew, Kelley, and Pat, thank you for joining us. Before we begin, make sure you guys unmute your microphones. I want this to be kind of conversational. I think the best webinars are conversational. I've got a lot of questions for you all. And I want to start with a couple things here. 2020 has been a really challenging year for everybody. But I think specifically, 2020 has been a challenging year for direct support professionals. And I'll tell you why. One day, we're working with people in their communities. We're working with people in their jobs. We're working with people making friends. We're helping people access things in their lives. And then one day in March in 2020, the office closes. And we're no longer helping people in jobs, and we're no longer helping people go out to restaurants and movie theaters and making connections in their community. And we had to redefine this work, completely redefine this work. So I want to know, and we're going to start with you, Kelley. What affected you most professionally about COVID-19 and this pandemic as a direct support professional?
Professionally, I would say that things became almost, the common thing right now is the idea of the new normal. And to me, as a direct support professional, that meant breaking out of routine. So what 2020 really did for me was help me realize how stuck in a rut, not even just a routine, but a rut that I had gotten into with the individuals that I support. So as things kind of changed, and we get flooded with all of this news, one of the first things we did was kind of shut off the TV, shut off the news. Let's put things into what I would say practical, make it practical, so all of a sudden now I'm cleaning 80% of my day, where usually I was driving them to and from their day program. And so they usually just saw me in the van. So now we're spending all this time together. And it turned into, as the year progressed, it turned into the guys learned a lot about me and I learned a lot about the guys. There was like a brand new place to be. It was like I had a new job and I didn't even apply for it. It was interesting.
Thank you, Kelley. And Pat from Toronto, Canada. Welcome, Pat.
Thank you.
What affected you most? How did COVID-19 affect you in your job as a direct support professional?
When the whole sit-home started, this was in March 2020, yes, I had to watch the people we support, we call them members. I have to watch things being taken away from our members and the effect, the impact on them. And we as the direct DSPs, we have to be there to be able to support the transition. I don't want to use the word grief because things being taken away, it's not just the home visit. Before we now started looking for substitute ways of connecting the people we support with their families, taking all the visitation, the day programs, their friends, they can see their friends, and the impacts on the members we support. Like Kelley said, we spend time with the people we support right now, and I could see the resiliency in them that we never thought they had, how they could cope with the changes. And personally, as a staff, we go home, we deal with our own personal family, and coming back to work, having to deal with the people we support too. I have a daughter that's been home for over a year now that can go to school. I go out every day, I'm scared of not bringing something home to her. So it all evolves around resiliency, safety, changes in everything that affects everyone.
That's a lot of stress. That is a lot of stress, supporting people and worrying about your home life. Thanks, Pat. We're going to come back to that too. Matt, as I did your introduction, one day you were supporting people in day services and the next day you're on Zoom with people. How did that affect you? And how did it affect you, but also how did it affect the people that you support?
My job is dramatically different now. I do provide, it's completely remote through Zoom, the services. But my job didn't change, like it wasn't as, I didn't go from being providing service in day program person to immediately doing this. The city shut down effectively in late March, and I was not working at all until the second week in June, I think. So I was disconnected from everybody at program. I was employed, but not working, not being paid. But I felt lucky enough to actually get a job doing this, providing remote services. So most staff were still left unemployed. But so that period between late March to the second week in June, I was completely dislocated from the people that I used to support, and that was pretty hard. And then of course there was very little interaction with my coworkers, maybe through the phone, but there was that disconnect too. So that was a dramatic and hard change. But then when I started providing remote services in June, I felt like my job became, it was almost trying to cultivate that community that used to exist at day program. There was that sense of an extended family, and they were missing that. At first, there were only a few people doing the remote supports. Our agency had to send out all these iPads to people who wanted to be part of that, and slowly, incrementally, the group expanded. And so recreating that feel that we have at day program I felt that was became really important. And they were missing day program every single day. So doing that, recreating that sense of community and family over Zoom is really ridiculously hard, but we got to some semblance of it, I felt.
Thanks, Matt. And I just want to let everybody, this is a webinar about vaccines, and I promise you we're going to get there. But I also want to know from Matt and Kelley and Pat, in terms of the NADSP, you are the representative voice of the workforce, and that's a big responsibility. We have an audience here who may not know exactly what you do as direct support professionals. So here's an opportunity. What do people need to know about direct support professionals during COVID-19? I'm going to start with you, Kelley, again. What do people need to know about direct support professionals?
Direct support professionals basically put everything on the line all day, every day that they work. Ideally, it's you have somebody's life in your hands. I mean, it's not necessarily life or death, but you are the person that's, I guess I'll always be that person that drives the van, but I guess metaphorically too. You're metaphorically, you're driving this person to be the best person that they can be. You're applying, you're supplying them with as many tools to live the best life as possible. So, when something like COVID comes along, your tools as a direct support professional are cut off you're stuck to basically what can you find on the internet to provide entertainment that you might normally get by traveling to, say, the mall or a movie theater. It's all of a sudden I'm finding movies on YouTube. Can't tell you how many times we watched Grease on YouTube, but yeah, I think that the thing about the workforce, especially over 2020, is that you're putting everything out there. I know that kind of the mantra of a direct support professional is leave your personal life at the door. So once you're in the door, you are the person supported's life. That's all that matters. And really, you're just kind of the tool to help that person live their life. Be it kind of in my case where it was, let's shut off the news, let's talk about things practically. This is why I'm wearing gloves. It's not necessarily all these scary germs necessarily, but it's let's talk about universal precautions in general. Things that I get trained on. It's an opportunity for me to teach on even a basic level, and then kind of build up to a higher understanding of why we're using these universal precautions, but why they're always important just in general.
Thanks, Kelley. Great example. Pat, I'm going to give you a different question.
Okay.
Pat, in the report that we just released, we know that direct support professionals are working more hours than ever before. Organizations are having a harder time. It was bad before the pandemic, but organizations are having a harder and harder time hiring direct support professionals during the pandemic. Have you been seeing that? Are people working more hours? Are people stressed? Are you having a hard time, or is things stable up in Toronto?
Right now, I can say that things it's been stabilized now. Initially, when it first started, the fear takes so many people away from work. But we as DSP, full-time DSP, we have to work. We have to be there for the people we support. We have to be there to assure them that we are there for them. When all these changes started, they were scared, they were worried too. We have to be the go-to person for questions. Once you step into the program, they have a lot of questions. Lots of people run away, but we are there.
A lot of people.
But right now, I think we are more stabilized, because with vaccines and stuff that came in, lots of people feel more comfortable coming to work now. We have agency staff now coming in. Before, they would rather, again, on the other hand, they would rather go collect the funding government provide for people who don't have job to do than take the risk of working. But we as full-time staff, we are there. Even their organizations provide us though with our full PPEs, all the protections that we need. And we're able to manage it through the time with the people we're supporting too. So it's kind of stabilized. To answer the question, we work our normal time now. We are not allowed to work in two facilities. So people with two jobs still have to stick to one job now.
Yeah, yeah. There was a lot of talk early on. We talk with organizations, and DSPs in the States. We since we've been closing institutions down, we've been talking about we provide services in the community. We are a community living model, right? I think in a pandemic, we can say we're healthcare workers because DSPs, according to the report, they're spending most of their time helping people stay healthy and safe, finding ways to cope, finding ways to deal with the stress, finding ways to connect with parents and family members and people that they love. The job is completely different. Yeah, you're always providing direct support, but in Matt's case, I mean, he's providing direct support through a camera lens. And Matt, I want to know a little bit more about that. I think some people on this call may worry that, will we rely on Zoom as the new direct support professional practice? For me, I think DSPs are essential and vital face-to-face, but there may be some times where, this is a good way to connect with people, a convenient way to connect with people and to check in with people. What's been your experience over the past year, Matt?
Well, when I was first offered a job, this opportunity, again, very few staff were offered this. And first of all, you need to come equipped. You needed a laptop. You needed to be well versed in the technology, and you had to come up with your own curriculum. Even if this was all brand new to all of us, but you had to have like a week-long group of activities, like circulating, and you had to meet people's goals in some respect. There had to be that mix of entertainment and education, and that is really difficult to attain. In any respect, and never mind like from scratch. So that was a challenge, and I was thankful to have the job, that opportunity at all. But I was also lucky enough to have the equipment, the laptop, and to have some acquaintance with the technology. And then it was only late into the fall that they put together, and this is a positive thing. The agency put together a curriculum team, they got an agency-wide curriculum team together to create something official that they could have, whoever's going to be providing remote supports, they could have some building blocks. They could have examples of activities. They could have something official. But that was obviously pretty late into that period of providing remote supports. And it was a pretty large panel, and very few of the people on the curriculum team were actual DSPs. Most of them were management. Many of them were supervisors who had been providing supports before they offered it to direct support staff. But it's very challenging. I find it rewarding when I'm able to find an activity that keeps them coming back, that's educational and entertaining, but it's a massive challenge. And again, also I'm always trying to facilitate that feeling of community. Because we have people that didn't exactly get along at program. Then, in this sort of virtual room, there's some interesting, to say the least, chemistry. It's already difficult. To facilitate that sort of environment, and like a virtual environment to facilitate any kind of social sort of interaction. But again, it's a challenge. I found ways to deal with it. There's some positives and negatives, but I hope we don't rely on this permanently. I do see this as continuing for several months at least, though. But I hope not forever. We still, it all depends on the nature of the pandemic, how long it takes to reach herd immunity and all of that. But I do think this is something that's going to be here to stay for at least a little while.
You know, it's funny. You said something. I'm sure I'm not the only one that picked up on this. You said something that was really, really important. The feeling of community. The feeling of community is not community, right? And I think that's a Donna, that's another webinar that we might want to do in the future. But thank you, Matt. I want to get to the vaccines. And I know that Matt and Kelley have both been vaccinated. You don't mind me telling everybody, you're going to tell them anyways. And Pat, how about you? Have you received the vaccines?
And the first dose.
The first dose. Okay. This is really important. You know, I've read several articles, not only in IDD, the direct support professionals who support people with intellectual and developmental disabilities, but the healthcare workers who support people who are aging in nursing homes, the other sister direct support professionals in other sectors. There's a real concern that almost half of the direct support workforce is refusing the vaccines, and they have their reasons. What are your thoughts about that, Kelley? I mean, what are your coworkers telling you?
I'm kind of getting about 50-50, I would say, as far as you know, people who want to get the vaccine. I haven't really heard why some people haven't wanted to get it, but I know that it tends to come down to certain, you know, just overall beliefs, and it doesn't really seem to be, you know, it doesn't really seem to be something that's necessarily debatable, at least not, you know, in the moment. But they're not so against it that they're, you know, speaking out against us, those of us who have received the vaccine. It's I think more just personal choice, and you know, that's the nice thing about the agency that I work for, is we weren't, you know, told we have to get it. I know that in some medical field, you know, was, you know, you can't show up if you don't get the vaccine, and we were not given any ultimatum or anything like that. So I think that although they may be not in the mood, or, you know, in the idea of getting the vaccine now, I think that at least they're appreciative to be in a position where it's not an ultimatum and it's not affecting their likelihood to be able to work in any sort of way.
Yeah, thank you. Let me ask you this, Kelley, while I have you. Did you have any fears about the vaccine before you decided to get it?
I didn't, not when it started to be available. I know that back in March, when the pandemic started, it was probably by, let's say, April, you know, not even 60 days later, and people are already talking about let's make a vaccine. At that point, I was like, there's no way you're going to see a vaccine in months. You know, it's going to be at least a year, if not two. You know, so kind of coming scientifically, you know, skeptical, I think, at that point. But you know, I think that learning about the vaccine and you know, being careful where I got my information from.
Yeah.
Like the NADSP provided some very, very helpful throughout the entire pandemic with Dr. Rader. That was very helpful to make sure that I felt like I was not getting biased information. It was, you know, compared to news media where it was kind of competitive information, this was just point blank scientific information. And so for me, coming a year later, you know, having purely scientific understanding of what was going on with the vaccine, I didn't have any kind of hesitation when it was my turn to step up.
Yeah. That you raise a really good point. I'm going to pass this over to Pat. You're right. I think getting your information from a reputable scientific source is really important. Pat, I mean, where do you think where are your coworkers getting their information? And do you think that there is some misinformation going around from DSP to DSP?
Well, naturally, DSPs would talk and would discuss about the fear that, like Kelley said, initially, everyone was skeptical, waiting for A to take before I take to see the reaction. But with time, Canada, it's a little bit behind.
Yeah.
Other countries have taken, we hear reactions from different countries. The organization I work with actually are very good at providing information. Under health and safety, we have the IPAC committee, which is the Infection Prevention and Control. We have a training actually under that committee that all staff are mandatory to take. That training teaches and tells everyone updates about the vaccine, how to deal with the virus, and everything. Also, our health ministers, even the Prime Minister comes on to talk of each vaccine on air. The mayors, all the premier health ministers. So DSP listening, even when they come to work and say, oh, did you hear this? From where? Oh, the minister just said it. You turn on the TV, you listen to it, and some stations keep repeating it, so you won't miss out.
Yeah.
And there are websites too that you can go, but that's under Ontario Health. I can't remember the name offhand, but you go there, it's authentic. You hear different vaccine, the effect on people. The AstraZeneca, we just had a case of blood clot, the first one. So that I know has been put on hold, and everybody is skeptical about taking it from beginning. So when people hear this now, we DSP actually got the Pfizer one. So from my organization, we all got Pfizer and Moderna, and people are comfortable with that. So we are well informed by our authorities. So
Thank you.
And our doctors too, they send emails
Yeah.
to update us about
Yeah.
the vaccines and the effect of it, the advantages.
Well, you know, Pat, thank you. I wish every direct support professional would go to those sources for their information. In the States, it's the CDC. You know, that's where you're going to get. And the other thing is, you know, information changes. You know, what we knew about this pandemic 6 months ago is different than what we know today. And Dr. Rader speaks to that all the time on our webinars. But I want to shift a little bit here, because this is really important to me. I know that direct support professionals help people that you support make decisions, helping people make big decisions or small decisions, right? We're helping people make informed decisions. In your roles as direct support professionals, how are you helping the people you support understand information about the vaccine and the safety of the vaccine? I'm going to, Matt, or actually, if any of you want to jump in, just raise your hand first. Or I could pick on you. Matt, go ahead.
The people that I support have traumatic brain injuries. And one of the things, so one of the things they have to, one of the challenges for them is to be able to concentrate on something. That's something they really need, they feel they need to do. And what really works using screen share is the reading together, reading material together. And that's become popular for everybody now. And one of the things, what I find with one common characteristic among them is their thirst for knowledge, their curiosity. And so often what we read is about science. And writing about science. So we read we don't read scientists writing, we read science writers who were explaining maybe concepts that are difficult for non-specialists to understand. And so it flowed easily into reading about the science behind the virus. I mean, that was fascinating. And then the science behind the vaccine. So we were kind of, we had all of this information already. It was just something we were doing naturally, talking, reading about this science. And so I felt they were well informed in that respect. That was divorced of stuff they were watching on TV. This was something that they, this was an activity that they were engaged in, and it was, I think we all felt that this was something beyond politics, and we understood it was a real thing, and yeah, I think talking about the group that the support, most of them did get the vaccine, and there was actually very little hesitancy, because I do think we learned so much about the science. There were a couple, but the reasons why they gave, why they weren't getting it was because they live with their families, and their parents said they weren't getting it. And in one case, during one of the groups where we were discussing it, one of the parents got really upset and thought that because she thought that we were telling her child that he had to get it. And of course, that's not something we do. We provide the information, and we can only make a suggestion. We can advocate to a certain degree, but we of course can't mandate it. It's only been given emergency authorization. So I think that's what I found has been one of my key roles, is providing information and making it. It was an enjoyable activity, actually. Understanding the science behind it. Not getting in too technical, but as much as we could understand. And I do think that brought a comfort level to them. Anyway, yeah, of course, but in some cases there were, it was out of for some of them, it's out of their control, whether or not they can get it. It's out of their control. It's in the hands of people that don't control them, but their guardians. In this case, their parents.
You once again, Matt, you tipped a couple of other thoughts in my head. One is, I think, as you described it, sounds like a best practice in helping people that you support not only learn about the vaccine, but learn about the virus, and interpreting it in a way that is understandable and practical. Listen, I've got a brother who's a PhD who studies mRNA, and he actually did a webinar with us. I know how detailed and how complicated this is, but when it's explained properly, it's so easy to understand. And the facts are that these vaccines, according to my brother who's a PhD, are highly effective and very, very safe. And on our website, we have those webinars available to you if you want to listen. One of the things that I worry most about, Matthew, is the opposite of what you did. Direct support professionals who may influence people that they support to either get or not get the vaccine. And that would be unethical, because all of us who have ever been a direct support professional, we all know that we do have influence over the people that we support, whether we like to admit it or not. We can be influential. And that's one thing. Using coercion is highly unethical, that we need to make sure that if we witness a DSP in that activity, that we need to stop it and report it. because I know what happens. Kelley, do you have anything to add to that?
I think that Matt hit the nail right on the head. I think it's all about providing the information, and like I said before, providing the tools to make your own decisions. Be it what we think is best or not best. It's not our life. It's not our choice. And so I think that for me, it kind of posed a little bit of difficulty. The gentleman that I support, they communicate non-traditionally, mostly non-verbally. So it's hard to kind of gauge without really knowing them very well. How things are going. So for me, it was a matter of we get the forms to sign. As I'm signing mine, I'm kind of telling them what I'm doing, what I'm filling out, and kind of gauging by facial expressions or just general reactions to what I'm doing. If there was any sort of a hesitation, then that's where I would kind of step back and say, what are we doing? But they were pretty, they were with it. I think that, kind of the way that we had kind of approached the pandemic in general, with just, like I said, the practical information, the abstaining as best we can from general news media, or at least sticking to one source as best we can, and not ping-ponging from a bunch of different TV stations that may or may not have their own agenda. I think that that's I think the main thing is just not have an agenda. It's just open, honest conversation. Whatever happens, happens.
Exactly. Now we're running short on time, but I just want. Oh, go ahead, Pat. Go ahead.
Okay, so I was just going to chip in that in the facility I work, things are done a little bit differently because it is a treatment home. So the BT, it's really involved in this. The DSPs, though, will support the members to understand the COVID outcome of the vaccine, but the BT comes up with a meeting with the members to tell them, and more like training, we call it training, in different forms for them to understand the COVID itself, the vaccine, the advantages, the impact, the different vaccines, and what it does. We use social stories and different things to explain it. So the RBT is more involved in it. And the members just come back to us that, oh, the BT said this, is that so? Then we now have to say, yes, I'm taking it too, because it's advantage. I give them the advantage to me and what it does to my family and how it will affect them relating to their family, reminding them that if they get the vaccine and mommy gets it, keep it safe for mommy to visit or you visit mommy. Just explaining, training, letting them understand the safety behind taking it and that every one of us are taking it too. So I don't see it as coercion, but just letting them understand everyone is taking it around here and the safety generally.
Yep, got you loud and clear. Listen, I've got a question for each of you, and it's going to kind of come full circle. Direct support professionals have received a lot of attention over the past year, good attention. You're essential workers. You drive by places where DSPs work and there's the banners that say heroes work here. And how I feel about that. The three DSPs know how I feel about that. But it's good. I mean, you're receiving recognition more now than ever before. DSPs have often been kind of an afterthought or in the shadows. And over the past year, direct support professionals have truly risen to the occasion and are starting to receive positive attention and recognition. As a direct support professional, we'll start with you, Matthew. what do you want DSPs to receive as we pull out of this pandemic? What do DSPs need from government and funders and policymakers?
So where to start? I mean, I mean, part of what NADSP is and what they're all about is redefining the DSP and what a DSP is and the duties. Because the job responsibilities of a DSP are so varied. I mean, even my case, my responsibilities can change from day to day. It depends on the situation. I have to know, yeah, and that's so that has to change. That's something. The DSP, it needs to be some sort of, there needs to be some sort of standardization. So generally, all DSPs can receive the benefits of whatever kind of funding the federal government is provides us with. But I think that's the first step. I mean, just standardizing what a DSP is and firming up the identity of a DSP. I think that we do need monetary support from the federal government. I do believe in a career ladder within that within the DSP field, job field. I mean, that would boost, that would lower turnout, and that would boost morale within the field. That's my biggest pet peeve, is the lack of a career ladder, because in most cases it's just seen the DSP position is just seen as a stepping stone. Most people are like, I'm going to do this 1 or 2 years and I'm moving on to, as quickly as I can, to management level. And I'm just asking him, like, what's wrong with this job? I mean, why not? It was like, oh, it's all about the money, a few thousand extra, and that's it. But I mean, for me, it's so much different. Even from going from a direct support staff to a supervisor, it's going from being able to work directly with them all the time to mostly working in the office behind a computer and in front of the at the desk. And of course, there's the union, moving on from the union. But I've gotten off track here. But I do think the key is the career ladder, and the fact that you can be a DSP for a while, you can find a career in it, and you can feel proud about being a DSP. You can talk about being a DSP. People will know what a DSP is, and this is something that should be wherever you work, in Canada, the United States. That feeling, you can feel pride and people know what you're doing, and it's something you should feel you can do for a long time. I guess I've kind of maybe gone too far, but
no, not at all. You said pretty much everything. I'm just going to see if Kelley, and because you career ladders, recognition, living wages, all of those things. Kelley or Pat, do you have anything you want to add?
Donna. Yeah, I would say that mostly what we need as I tend to refer to us as the invisible workforce, and it's kind of twofold. One is kind of intentionally invisible, and one is we're not actually recognized as an actual occupation. You know, I mean, if you are doing your taxes, you pull down the little tab, And I said, well, what is your job? There's no DSP on there. We need something to actually define our job. We need to be defined as an actual workforce, because we're not on that box. So I can't do my taxes. No, I'm gonna do my taxes, I promise. Tax day. It's tax day. I promise I did my taxes. But you know, I think really, you know, it comes down to, we need to be recognized as an actual workforce. And I guess secondly, the other side of the invisible workforce is that we're kind of built to be invisible. We're kind of the crutch of the people we support. We're kind of meant to not be seen. We're supposed to be making the people we support seen and flourish. That's the idea of our job, is to be kind of why somebody got where they are, not necessarily, you know, the one taking the credit for it. The credit all goes to the person supported, most definitely. You know, so kind of being built as an invisible person that just wants to be recognized as having a job.
That's a needle that we have to thread. Donna?
Yeah, let me just jump in. For a second. I think that something you said, Kelley, was really important. You talked about there's no real job title. You can't check this box that says DSP. But earlier on in the pandemic, you know, at the state level, there were a lot of folks, including many from developmental disabilities councils, that were working through, you know, creating those tiers, those phases and tiers that we saw appear for each state as to who could get the vaccine when. And I think that was the first time that I saw in many states, because I got to look at a lot of the language as it was being developed, where DSPs were actually named as DSPs and put into that essential worker category. How did that make you feel? Like, you know, any of the three of you, like, was that a moment of, wow, I feel valued, I feel recognized, my actual real title is maybe for the first time actually appearing in writing? Did that make a difference for you?
Yeah, and it kind of, I guess, in a way, it kind of made me laugh, because I learned that we actually, as 1A, got put ahead of clergy, which is on top of a lot of people all over the place. So I think that from about the humble, but also, you know, I guess boastful at the same time, you know, it's like, okay, so I got put ahead of somebody, and that's just such an unnatural place for us to be, that it was just pretty epic.
That's good to hear.
There was some confusion in New York. This was just about the time of the lockdown. Coworkers and I, the day program, we discovered, all of a sudden we were essential workers, and we could go to work. If we got one of these permission slips, we had to bring it with us and show it to the law enforcement. But then the day programs closed, so that we were no longer in that category because we didn't have a job. But there was that confusion at first. It was like all of a sudden we were essential in that category. Well, not so much, because day programs aren't essential. It was decided, and they were all shut down. It was that day of confusion when, oh my God, we're still gonna be working through this, and then we weren't.
I'm out of questions.
Well, I just want to make sure, Pat, I kind of cut Pat off a moment ago, and I want to make sure that she finishes what.
Oh, okay. So I
think we can open it up for others' questions.
Okay, I was just going to add to it that DSP's voices need to be heard.
Yes.
We are the one doing the job. Decisions are being made for us at the management level, and we are not heard. It's the reports from the supervisors, right or wrong that decisions are being based on. So we're like being silenced. And those are things that I think should be thought about for DSPs too.
Well said. All right, we have some time and I would love to open this up now. I'm sure that people do have questions that they would like to ask. If you want, you can either raise your hand so we can see you and call on you, or put your hand up in the chat box with the little hand that can come up. So who would like to begin? Is everybody being quiet and shy this afternoon? While folks are thinking of other questions that they'd like to ask, maybe I can kick one off as well. Just I want to make sure I understand this from some of the things that you guys said. And Pat, you just sort of touched on it a little bit, which is that the people you work for, the provider agency, I'll call it, it might be called different things, but they're making important decisions for you. They direct your wages, they tell you which clients you're working with, et cetera. And Kelley, I heard you say that you were, I think what you indicated is you felt good that they left it up to you to decide whether or not to get the vaccine. I wasn't sure if I heard that same thing from Pat and Matthew. Were you also left to make your own decision, or was that something that the management was directing you?
In my case, even though it makes it look like we can decide not to take it, but for us to be able to support our members when the opportunity of DSPs to get vaccines rolled out, we're kind of mandated to register to take it, but also we are told if you don't want to take it, you have to get a note from the doctor why. And you may not be able to work at the facility. Even though that was subtle, but.
Right, so you're sort of pressured in a way.
In a very, very subtle, unspoken way.
And, each of you obviously made your own decision in the end to take the vaccine. How do you feel about, if you're going to end up in people's homes? I know, Matthew, you said you're still, I think, doing all of your work by Zoom, is that right? But at some point, you guys are going to be face-to-face again with those who you serve.
Right.
Will it give you pause if they haven't had the vaccine? At NACDD, we like to talk a lot about kind of three legs to a stool, right? It's going to work best. Everybody will be safest if the DSP, the person with IDD, and whoever else is living in that home or in that workspace that you might be going to are all vaccinated. Then we have, complete immunity, we hope. But how would you feel about having to, be close with somebody in their home, perhaps, or in that workspace, even if you have the vaccine, but they don't? I see, Kelley, you look like you want to share some thoughts there.
Well, I think for me, I'm residential, so I'm always in the home. If the gentleman that I support would have decided that they were not going to get the vaccine, whether or not I decided to get it, it probably wouldn't have affected me horribly, just in terms of right now we have kind of the masking policy. And so I think that perhaps, one way to think of it is if it was a matter of vaccine versus wearing a mask all the time, it was easy for me to say I would rather, have the vaccine and not have to wear the mask once that policy would, absolve itself. But I think that I've also kind of gotten now to the point where I'm so used to wearing my mask for 7.5, 8 hours a day that I don't even realize it. Sometimes I'll answer the phone and nobody can hear me because I have this mask on, and I didn't even really know I have it anymore. But I know that definitely a positive for getting the vaccine would be that less reliance on a mask. And so, you know, somebody like the people that I support have some real issues, be it sensory or just, you know, personal issues with wearing the mask, that I think that may have helped out in their decision to get the vaccine, where they would feel a little less, you know, pressured to have to wear this mask all the time.
Are there others who have questions or comments that they just want to share today?
I just wanted to answer your question.
Yeah, please.
So my agency does not mandate, does not require the staff to get vaccinated. And I know that most of my coworkers who our day program is slowly reopening, and now it's at 15% capacity. But I know that my coworkers who are now working at the day program, most of them have not gotten vaccinated. But most of the people we support have gotten vaccinated. And the conversation about why there's no like conversation, they don't want to discuss that. Sometimes it has to do with safety, or I've heard, people I really like, and I've been close to for a long time, some of them, but yeah, it's just not something they want to discuss. Or it could be that they don't get the flu vaccine, they don't get this either. Their bodies are strong enough that they can withstand the effects. But yeah, that's the environment at work, my coworkers. And it's something that it's hard for me to grasp. It's hard for me to grasp.
Thank you so much for sharing that. Pat, do you have any last words that you want to share?
Yes, in the program where I work, all the staff, all the people we support, we've all been looking towards to when the vaccine will be available for us. So we didn't have any problem taking it. We all did, all the members did, all the staff did, and none of us had any issue. And we're actually looking towards when the second dose will be ready for us.
Great. I want to ask one more time before we come to a conclusion today. Are there others who have questions or want to share any of their thoughts with this amazing panel of DSPs? I think it's growing late in the afternoon, and people are probably feeling a little tapped out. I'm so blown away. Well, both Matthew and Kelley know that I heard them speak a month or so ago at another event, and I was just so impressed. And Pat, thank you for joining with Kelley and Matt today. The information you guys are sharing with us to kind of bring us in to feel like we're almost living a day in your life and walking in your shoes a little bit is so valuable to us to understand what this feels like for you, what this whole year plus has felt like for you and in the work that you do. And I hope that you feel that everybody who attended today feels that value and that respect for everything that you have done. We know that you are essential. Each of you does incredible work every day supporting people. It's been a long, hard year plus for all of us, but especially for people with IDD who were, as Joe said, literally, one day we're going to work or going out in the community, going shopping, to the movies, to see friends, and then they were shut down. We all had to turn around on a dime. And for some people, that was very difficult, but you all continued to be there to support people through that really difficult time when they probably felt scared, lonely, isolated from the things that they were very used to. So we have great respect for what you have done, what you have accomplished. And thank you for sharing. I love, Joe, that you asked them to share a little bit about what they need from government, what we need to really elevate this career path for DSPs. At NACDD, we fully support that career ladder. Joe knows we're full-on partners in trying to really elevate the work that you do and fight for better pay and more equity in what you do, because what you do is an incredible job and really should be a career destination for many people. So we appreciate all of you. I want to thank Joe again for really managing this amazing conversation and for your partnership. We appreciate that. Nicole, thank you to you for helping to coordinate and make all of this happen at pretty short notice. And I want to thank everybody who attended today. I saw probably close to 200 people between the Zoom and the Facebook Live. That's really exciting. I saw people from a variety of national organizations and from government who have been here. And it was such a pleasure to hear from all of you. And Pat, thank you for bringing a perspective from another country. You know, Canada's not that far away, but it is another country with a very different governmental system. And so thank you for sharing your experiences and your thoughts about how things are the same and how they're different, because it's a different country. So again, thanks to all of you for being with us today. I hope that you learned a lot. If you have follow-up, please reach out to us. We did record this session, so anybody who would like to receive the recording, we're happy to share that with you. Just let us know. And I wish everybody a great rest of their evening. Thanks so much for being with us today. Take care, everyone.